guys, and welcome back to my channel. If you're new to my channel, my name is Michelle, and here on this channel I make mommy videos and I also vlog. But for the month of November I am actually doing something a little bit different. I am doing an allergy awareness series. So if you guys haven't seen the first video of this series, then I will leave it linked in the description box, and I'll also link it up above here so you guys can go and watch that and kind of get a little bit more info about why I decided to do this series. But for today, I'm going to be talking with you guys about what is an allergy, some common allergens, signs of an allergic reaction, and what are some next steps. An allergy is a damaging immune response by the body to a substance to which it has become hypersensitive. So your body is fighting against a substance that it really isn't able to identify that it is okay, that it is just, another food. But your body has now become hypersensitive to that substance, and your body is now trying to fight it. So some common allergens are milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. Less common allergens would be, I'm going to read them off to you guys here, are linseed, sesame seeds, peaches, bananas, avocado, garlic, kiwis, passion fruit, celery, chamomile, aniseed, mustard seed. In terms of when you would get tested, basically you can get tested as a preemptive measure. So you can go into your family doctor and let them know that you would like to do an allergy test. You can have them done, on your child, just to kind of know what they're allergic to, what they're not allergic to. And even as an adult, maybe there's always foods that you've never encountered or ingredients that you've never tried. So you can also go and ask to be tested. Another time you would get tested is when maybe over-the-counter medications are not working for your allergic reaction. So if you try some of the common ones like Benadryl and it's not working for you, that's when you would kind of say, okay, maybe I need to get tested and see if I need something like an EpiPen, or if you're unable to identify what your allergen is. So you may get an allergic reaction and have no idea what caused it, and you don't want to eat that fruit again and you're trying to think back. You can just go and get tested, and that way you'll know kind of for sure what caused it. So some types of allergic reactions are tingling or itching in the mouth, hives, itching or eczema, swelling of the lips, face, tongue, and throat, or other parts of the body, wheezing, nasal congestion, or trouble breathing, abdominal pain, diarrhea, nausea or vomiting, dizziness, lightheadedness, or fainting. So those are some things that you might start to see after you've maybe eaten a certain type of food, and that kind of would let you know that maybe there was something going on with what you've eaten. Signs of anaphylaxis would be constriction and tightening of the airways, swollen throat, or the sensation that you have a lump in your throat and it's difficult to breathe, shock with a severe drop in your blood pressure, a rapid pulse, dizziness, lightheadedness, or loss of consciousness. And this means that emergency treatment is critical, because when you're having an anaphylactic reaction to something, this can cause death. So you want to make sure that if you see that in someone else, you're seeing some of those symptoms, your best bet is to get emergency care, whether it's going to the emergency room, calling for 911, because that can cause death. It's not something that will just simply pass on its own. An allergic reaction may be uncomfortable, but not severe, and can be frightening and even life-threatening. Symptoms usually develop within a few minutes to up to 2 hours of eating the allergen. So you kind of want to make sure that's a window that you're kind of keeping an eye out. So next I'm going to talk about what to do after you've identified that you have an allergy to a certain substance. the first thing you want to do is to avoid eating that substance. Just avoid it at all costs. Number 2 is that you need to check ingredient labels of foods that you're eating to see if the product or the substance that you're allergic to is in that product. And another thing is that you need to learn if the substance that you're allergic to has other names. So sometimes, something could have a different name. So you need to make sure that you know what your allergen is and what it's called in different ways so that you know exactly what you're looking for on the label. Number 3 is to be extra careful when you're eating out. That means when you're going to a restaurant, when you are going over to a friend's house, when you're at a potluck, at work, at church, wherever. You need to be extra careful. You need to let people know that you have an allergy. Be very specific about asking what ingredients are in a product. And if you can't identify it or somebody else can't identify it, just steer clear. It's better to be on the safe side and just miss out on eating something than to eat it and to have a severe reaction. It's definitely not worth ingesting any type of food to go through all that, to go through any pain or suffering as a result. So just avoid it at all costs if you don't know what's in it. Number 4, if your allergy is severe enough to where you do need a EpiPen, then make sure that you are carrying your EpiPen with you at all times, and make sure that you have 2 doses, because sometimes your symptoms may reappear after you've used that first dose and before you get to the hospital or EMS arrives, you may get those symptoms to reappear. So you need to make sure that you always have a second dose as a backup. And number 5 would be, if it's possible, have those around you on a regular basis be trained in first aid CPR. It's definitely not something that is going to hurt. It's definitely something that is good to know for yourself. And it just kind of helps so that if anything were to go wrong and you are with that person, especially if it's somebody who lives with you, just make sure that people who are in close contact have first aid CPR. This is a good practice whether it has to do with an allergic reaction or not. And another thing is to really just make sure that you are as vocal as possible about your allergy. It doesn't matter if people are going to be bothered by the fact that you keep bringing it up. It is absolutely important that you are telling everybody and anybody that you have an allergy. It's not something to be taken lightly. It's something that is important. It's something serious, in some cases life-threatening. And even if it's not, there's no point in putting yourself in a situation where you're going to ingest something that is not going to make you feel well. So it's always best to make sure that you are educated and that you are able to educate those around you. That's it for this video, talking a little bit about what an allergy is. As always, I will link down below the Facebook page for the FATE initiative and also the link for the GoFundMe page. If you guys have any comments or questions that I could possibly help and answer, leave them down in the comment section and I will definitely get back to you. If you guys aren't already subscribed, hit the subscribe button and make sure that your post notifications are turned on so you can see the next time I upload a video to this series. And I will see you guys in my next video. Bye.